Module Overview. The endocrine system is a chemical communication system of the body that works in tandem with the nervous system to regulate vital bodily processes, including growth, metabolism, reproduction, fluid balance, and stress response. This module provides an in-depth understanding of endocrine glands, hormones, feedback mechanisms, and their clinical significance. By the end of this module, you will be well equipped to explain the hormonal control of body systems and analyze disorders related to hormonal imbalance, endocrine gland dysfunction, and hormone resistance. Full content explanation. Definition and functions of the endocrine system. A system composed of glands that release hormones directly into the bloodstream, maintains homeostasis through slow, long-lasting signals, regulates metabolism, growth and development, sexual function and reproduction, blood pressure, sleep cycles, circadian rhythm, stress response, calcium and glucose levels. Characteristics of hormones. Chemical messengers secreted by endocrine glands, transported via blood to target cells from tissues, organs. Types: peptide hormones, e.g. insulin, oxytocin, steroid hormones, e.g. cortisol, estrogen, amino acid-derived hormones, e.g. thyroxine, epinephrine. Mechanism of action: bind to specific receptors. Alter cellular activity, gene expression, protein synthesis, ion transport. Major endocrine glands and hormones. Here we will use gland, hormones secreted and primary functions in our table. 1. Hypothalamus releasing/inhibiting hormones. Controls pituitary gland. Links nervous and endocrine systems. 2. Pituitary master gland, GH, TSH, ACTH, LH, FSH, prolactin, ADH. Oxytocin controls other glands, growth, lactation, water balance. 3. Pineal gland, melatonin, regulates circadian rhythms. 4th, thyroid gland, T3, T4, calcitonin, regulates metabolism, lowers blood calcium. 5th, parathyroid glands, PTH, increases blood calcium levels. 6th, adrenal glands, cortisol, aldosterone, adrenaline stress response, fluid electrolyte balance, fight or flight. 7th, pancreas, islets of Langerhans, insulin, glucagon, regulates blood glucose. 8, ovaries, estrogen, progesterone, regulate menstrual cycle, pregnancy. 9, testes, testosterone, regulates sperm production, male traits. 10, thymus, thymosin, promotes T-cell development, immune function. Hormonal feedback mechanisms, negative feedback, the most common regulatory mechanism. Hormone secretion is inhibited when the desired effect is achieved. Example: high levels of thyroid hormone, T3/T4, inhibit TSH release. Positive feedback hormone secretion is amplified to achieve a specific outcome. Example: oxytocin during childbirth increases uterine contractions. The hypothalamic pituitary axis, HPA axis, a highly integrated system that regulates most hormonal activity. Hypothalamus produces releasing, inhibiting hormones. Anterior pituitary responds to signals from the hypothalamus. Target glands receive stimulation from pituitary and secrete hormones. Example: hypothalamus arrow, CRH arrow, anterior, pituitary arrow, ACTH arrow, adrenal cortex arrow, cortisol. Endocrine versus exocrine glands. Feature endocrine glands and exocrine glands will be used in our table. 1. Secretion route into bloodstream through ducts to surface. 2. Examples: pituitary, thyroid, salivary, sweat glands. 3. Substance secreted hormones, enzymes, sweat, mucus. Disorders of the endocrine system. Condition, cause and symptoms/impact will be used in a table. 1. Diabetes mellitus, type 1/2, insulin deficiency/resistance. 2. Hyperglycemia, fatigue, frequent urination. 3. Hypothyroidism, excess thyroid hormones, weight loss, tachycardia, anxiety. 4th, hypothyroidism, insufficient thyroid hormones, fatigue, weight gain, cold intolerance. 5th, Cushing's syndrome, excess cortisol, usually from tumor, obesity, moon face, hypertension. 6. Addison's disease, adrenal insufficiency, fatigue, low BP, darkened skin. 7. Gigantism, acromegaly, excess, GH, before, after puberty, excessive growth. 8. Dwarfism, GH, deficiency during childhood, short stature, PCOS, polycystic ovary syndrome, hormonal imbalance in females, irregular periods, hirsutism, infertility. Endocrine system and homeostasis. Interacts closely with nervous system, e.g. adrenal medulla, reproductive system, e.g. sex hormones, digestive system, e.g. insulin, gastrin, maintains balance in glucose, sodium and potassium, calcium, water balance. Clinical testing and diagnosis. Blood tests, e.g. TSH, cortisol, insulin, urine tests, e.g. catecholamines, imaging, CT/MRI of endocrine glands, stimulation/suppression tests, ACTH stimulation, glucose tolerance test, pharmacological interventions, condition drug therapy, diabetes, insulin, metformin, hypothyroidism, levothyroxine, hypothyroidism, methimazole, adrenal disorders, corticosteroids, fludrocortisone, fertility issues, hormone replacement therapy, learning outcomes, Bloom aligned. Bloom level learning outcome. Remember list the major endocrine glands and their hormones. Understand, explain negative and positive feedback mechanisms. Apply, interpret hormonal imbalances in patient case studies. Analyze, compare symptoms of hypo versus hypothyroidism. Evaluate. Assess hormonal therapy plans in endocrine disorders. Create, design a hormonal pathway. Diagram for stress response. Accreditation, mapping. Accreditation, body framework. Alignment, WHO. Health Science Curriculum Framework, NCLEX, US, NMC, UK, CanNCLEX, Canada. Allied Health and Paramedic Diploma, certificate level, BSc. Anatomy, Physiology, Public Health Standards, check mark CPD/CEU. Recognition check mark Europe, US, Africa check mark. Instructional activities, hormone role play. Act as glands, secreting specific hormones. Case study analysis. Diagnose hormonal conditions based on symptoms. Endocrine crossword and flashcards. Lab simulation, blood glucose regulation using digital platforms.